You got a bit more. One.
We're all here.
Alright, guys. Well, first off, before we get down to the medical business, it's been an honor to work with you. And I can't wait to see what you guys end up doing with your careers. But professors have graciously said to me to talk to you about my background. So when you guys have assessed me, you probably have maybe palpated or was like, what's that on the stomach, and was apprehensive to ask me. Now, most of you have. That is called a backfin pump. And what the backfin pump does is it helps me with that scary being tight. I would be as stiff as a board if I didn't have it, okay? Furthermore, there are some complications that I have had with it. We've been talking about overdoses, we've been talking about all that stuff, right? Well, you think I've been perfect, you know, everyone's got a chance to assess me. I don't know if everyone's had a chance. But what I'm getting at is it's not the same. You can't learn about backfin. If I wasn't here, they wouldn't know about it. They can't teach you everything in 6 classes or 6 weeks or whatever. So, a little bit about the overdose. I was frantic for my life, okay, when that happened. Had to be rushed to the emergency room after just getting out of the hospital in Minnesota. Minnesota feels bad to this day about it, and yeah, and just be aware of the backfin pump and the issues you might have, like for example, like morphotic, maybe waiver bleeding, and stuff like that. Now, you may say, I'm a regular emergency room nurse and I can handle this. Please do not handle this on your own. Please do not let the emergency room provider handle this, because this is life or death. And for me, there's only one doctor I trust here in Iowa to work with me on this. David Moore. I don't know, most of you might hear that name as you go out and practice, but to my knowledge, he's the only guy capable of knowing stuff about the pump. Other than surgeons, they just implant the pump, and they don't basically do anything but the procedure. Now, how do you think they fill the pump? How do you think they give me the medicine? I have spinal cord, catheter, goes down my spinal cord into the pump. how do you think they'd be feeling? Anybody have a guess? Anyone? Come on.
Your spinal cord?
Okay. Nope. They do a syringe shot, like,
A syringe.
and it's about 5 seconds, and they pump the medicine out. They have a little computer that can tell you where the dosage is. Now, for the nurse, you're capable of refilling the pump, but you have to have a provider's eyes. They don't have to be in the room, but a provider like Dr. Moore has to be present. So that means if I came in and had a pump issue, you could do all the running, you could do all that stuff, but if it got complicated, you would have to get the doctor, because the doctor is the only one that can really tell you as the nurse what to do. Adjust the pump up or down percentage-wise, or, maybe leave it alone. He'll come in, assess the muscles. You can assess the muscles, but ultimately, it's the doctor's prescription to make sure they have, the right doses. Now, is there any questions as we wrap up here? Any questions whatsoever right now?
So that pump, Justin, is implanted
Yep.
under your
it's
skin.
Implanted. You can see right here. Maybe if I.
Yeah, come on up if you can't see.
Yeah.
Yeah.
Come on up. So basically, if, let's say I'm getting a pump refill, and they need to inject the medicine. Again, they poke a hole right about here. They say 8 o'clock. Now, I didn't get the opportunity to get into this with the other groups. Probably should have, but there's always next time. But 8 o'clock is about, they say 5 to 8 o'clock is what they recommend the nurse looks for. You can palpate, they have measurement tools and stuff like that. But bottom line is, if a medical emergency comes walking through your ER doors, you best be calling the provider that handles the pump, which in this case would be David Moore from Ames.
So if you have a patient who has, say, a baclofen pump, and you're not familiar with it, because Justin's right, we can't teach you every single specialty situation that you're going to come across. There are a lot of things that you're going to learn once you become a nurse, and learn from other nurses, learn from experience. So if you come across a device like a baclofen pump or any other implanted device, there are devices that are implanted to control seizures. There are a lot of different things that can be implanted. So if you come across a patient, you don't know what it is, ask questions. You need to understand what you're dealing with your patient. Okay, because there are some very specialized things out there that you can't just assume, oh, it can't be that. during his medical emergency, had they asked more questions and maybe contacted Justin's provider, it might have saved him a lot of discomfort. Yeah.
So get to think about that stuff.
Any other advice that you have for them, Justin, as far as how to talk to patients and?
Well, it's kind of good point. I called someone Hun the other year, and she did not like it. You know, I've done this speech 3 times in the last 2 days, and basically I called someone Hun out of turn, out of, you know, I didn't know it was Proctor, but that right there is another reason you need to speak up as a nurse and say, hold on, this was not professional, what you said, you need to address it with the patient right then and there, because it caused a big uproar with a nurse that's no longer with Dr. Moore, and I almost lost him as a provider.
Okay, so we just need to, what he's saying is we just need to be careful with how we address people. Sometimes it's very tempting to call someone dear or sweetheart or hun or honey. To a lot of people that might be very condescending, or other people it might be triggering to some bad experience they had. So my recommendation is that you always address your patients by their name. Okay, try really hard. I know it's hard because I want to call you guys honey all the time, but I try really hard not to. Okay, I don't ever want to be condescending. So just really make an effort to call people by their name.
This one was like patient to nurse, so the nurse
Right.
could
And
say,
if
"I don't-"
you, yes, and if a patient is doing that to you in reverse, you absolutely have the right to say, you know, I've noticed you call me Hun a lot, and it makes me just a little bit uncomfortable. Do you mind calling me Susan? Okay. And you can approach it in a very calm, kind manner.
Yeah.
You know, I prefer that you call me by my name. And that nurse could have done that with Justin, but she chose to make a bigger
mountain out of a molehill.
And had she talked to him, he'd have understood. So it works
Like I
both
do
ways.
now.
Yeah,
So.
it works both ways. So
Any more questions, comments, concerns?
Thank you for sharing.
Yeah,
that.
thank you for sharing that.
Yeah.
Appreciate it. Learned a lot.
yeah, good advice.
All right.
Yeah, very interesting. Thanks, Justin.
Yep.